Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Today we'll welcome Dr. Andy Smith with Novant Health Surgical Associates here in Bolivia, and he's going to talk to us about general surgery. And then we'll speak with Joe Hall. He will talk to us about transcultural health. And finally, we'll get to know Dr. Robert Colucci, who's the newest member of the Novant Health Psychiatric Medicine practice located in Charlotte. So stay tuned to HealthWatch to learn more. Please welcome my first guest, Dr. Andy Smith, who's a general surgeon with Novant Health Surgical Associates here in Bolivia. Dr. Smith, thank you for coming today. I know how busy you are.
June, I'm happy to be here. How are you?
I'm well.
Good.
Thank you for asking.
Good.
So, we've been friends a long time. We've known each other a long time. So tell our viewers, how long have you been with Novant Health?
This is my 6th year with Novant Health. So I came in 2017, and it's been a great experience just to see how quickly things have been growing here, and the population's booming, and Brunswick County's growing all over. So it's been a really wonderful experience.
It's been a fun time to be part of Novant Health.
Absolutely.
Yeah, I know. So what made you want to be a general surgeon?
I think I liked the combination of being a complete physician, in general surgery. We take care of a lot of different body systems, a lot of different illnesses, a lot of different physiologies. But the surgical part of it was extremely appealing. I like working with my hands.
It's fun, isn't it?
It's fun. I like fixing things. I like that tangible nature. If something's broken, I can fix it.
That's awesome. I just love your the way you talk, the way you're so calm. I think patients and families probably really appreciate the way you come across.
Yeah, I think it's important, to be in control and in charge when things come up. We deal with some difficult situations, and being calm and patient are always helpful traits.
Yeah. So what are some of the most common surgeries that you perform?
So our group as a whole, we do a mix of things, and we all have some areas that we're, have a little niche in. But in general, I do a lot of colon surgery, gallbladder surgery, or hernia surgery, breast surgery, thyroid surgery. So it's a pretty broad, general surgery practice.
You don't get bored. You have all these different.
We don't get bored.
That makes it much more interesting. So talk to me about hernia repair. So how common are hernias?
Hernias are very common. The most common type of hernia is an inguinal hernia, which is a hernia that forms in the groin. In general, the definition of a hernia is essentially a defect in the muscular wall of the abdomen. And so what happens is an opening occurs for whatever reason. Sometimes it's a congenital hernia or something related to an incision that a patient's had previous surgery from. But nonetheless, it's essentially a process where an opening occurs underneath the skin, and some intra-abdominal contents are pushing through this defect.
Yeah. Do both men and women get hernias?
Both men and women get hernias, a little more common in men, particularly with inguinal hernias, and inguinal hernias being the most common hernia. About 27% of men will experience an inguinal hernia in their lifetime.
Do they always have to be repaired? What happens if you don't repair them?
So, not necessarily. It just really depends case by case. So, somebody who is not active at all, has a very small hernia and has no symptoms from the hernia, we might watch that. We might determine it's safer to keep an eye on it than to fix it. Although hernia surgery is very, very safe, the majority of patients that we see with a hernia, we likely are going to recommend a surgical repair.
And I'm just going to ask you this question. It's not even here. You hear a lot of controversy about the mesh that they use during the repair. Is it common to use the mesh now, or do we not use mesh anymore?
So that's a great question. It comes up, very routinely when I'm talking to patients about hernia surgery. In general, for most hernias, again, not all hernias, but for most hernias, when we're talking about hernia mesh, the risk of recurrence If we don't use a hernia mesh, which is just called a primary repair, the risk of recurrence of that hernia, it coming back, is very, very high, okay? If we put a piece of mesh in, it reinforces that repair and, generally speaking, reduces that risk of recurrence to a much lower number. To address your question, there were some meshes on the market in the past that were used sparingly. Right, that had some bad outcomes and some things like that. Those are not on the market anymore.
Good.
I never personally use any of those meshes. And I think, it's a matter of your surgeon being in tune and being up to date on what's out there and being very selective in the types of mesh that we use. So the mesh that we use here is very safe, has a very, very safe profile, and has been around for years, and millions of patients with that mesh who have done extremely well with it.
That's really good information. Let's switch and talk about gallbladders for a while.
Sure.
So what causes the gallbladder attack to be so painful? What is that?
Right, so there's a couple different types of gallbladder attacks that people can have. Sometimes it's related to gallstones that form in the gallbladder. Sometimes it's just related to the gallbladder not emptying properly. The gallbladder is a little sac up under your liver that's attached to the bile duct that is secreting bile from your liver. Your liver makes bile and secretes it into your intestines to help with digestion of certain things. The gallbladder, like I mentioned, is this little extra reservoir for bile. And so when you eat a certain type of food, usually something greasy or with a lot of fat content, fried food, I tell patients anything that tastes good.
Spit it out.
The gallbladder is a little muscular sac. It will squeeze and give you a little extra boost of bile. And so if the gallbladder is not emptying properly, if it's a little twisted or there's some narrowing there, that can cause some pain when it's pushing against pressure. The other reason is with gallstones, they can get in the way of the gallbladder emptying properly, and they can cause pain.
Speaking of gallstones, what causes a gallstone to form? What is that stuff?
Sure. Well, bile's made up of several things, bile salts and cholesterol being the main components. And usually it's a too much or too little of one of those things. And so what happens, just like with salt in water, it can crystallize. Bile salts and cholesterol can essentially crystallize and form small stones that get bigger over time, and they become gallstones.
Well, I know that some people end up in the emergency department for gallstones or gallbladder-related pain. So would there be symptoms prior to that point that might alert them that there's a problem, and then do something before they end up in the emergency room?
Sure. So the most common symptoms we see with gallstones are what we call biliary colic. Those are those general symptoms from gallbladder disease. People can have right upper quadrant pain. Again, we mentioned the gallbladder is up on the right side under the liver. So right upper quadrant pain. Typically, it's pain that comes on after eating. Oftentimes, some of those foods that I mentioned, and usually it's self-limited. It'll resolve within a few hours. Sometimes it doesn't. A lot of people end up in the emergency room. It can cause some chest pain, epigastric pain.
Oh yeah, you think you're having a heart attack.
Correct. Yeah. So it's important if you're having those symptoms to come in. Let us check you out and make sure we know what's going on and rule out something like a cardiac issue.
Right. Yeah. Well, we're running short of time, so I did want to touch on minimally invasive procedures.
Sure.
So tell me how your group, does your group perform those types of procedures?
We do.
And what kind of procedures would we?
So we're fortunate we have, and for several years have had the Da Vinci robot surgical system here. So a lot of those colon surgeries and hernia surgeries that we talked about, and gallbladder surgeries as well, are done with the Da Vinci robot. And the benefit of that is small incisions. So numerous, or most of the time, it's 4 or 5 small incisions with the robot. And we're able to do the whole operation that we used to do through a larger incision with the robot. So the results are less pain, faster recovery, out of the hospital sooner. So a lot of benefit to the robot and that minimally invasive technique.
Yeah, I have seen patients get out of the hospital that very day.
Absolutely.
It just depends on the patient and the procedure. But
sure. Yeah, it's been amazing to see, patients that used to stay in the hospital 3 or 4 days after a certain type of operation may go home the next day. And that's just amazing and good for the patient and everyone involved.
Yeah. Well, Andy, thank you so much for being here today. It's such a pleasure to have you. I know how busy you are, and I know you have to get right back to surgery. So thanks again for being here, and I look forward to having you back.
You're quite welcome, June, anytime.
now let's welcome Joe Hall. And he's the Transcultural Health Manager with Novant Health. That's a mouthful, Joe.
It is a mouthful, it is.
So welcome to our show today. I'm so glad to have you. I've missed seeing you around the hospital, but you have a great new job that you're going to tell us about.
I do, and thank you so much for having me.
Well, it's really my pleasure to have you here. So let's first start with your background.
Sure.
Let our viewers know where you've come from. Where did you grow up? Where did you go to school? That kind of thing.
Oh, wow. Okay, so I grew up here in the Wilmington area.
Nice.
All the way through from Carolina Beach Elementary, graduated from Hoggard High School. I have been a nurse now for 23 years. I can't believe 23 years has gone by so fast.
It goes by so fast, doesn't it?
It has. I have a master's degree in the science of nursing with an emphasis in education. Mm-hmm. And through that career, I have been allotted wonderful experiences from working from critical care to emergency medicine to leadership.
Yeah. Well, great. I'm really excited to learn about this new venture that you're on. So, just recently, you began serving as the Transcultural Health Manager. And I know you said to me one day, you get strange looks from people when you say that. So probably I was the first one. So just tell us a little bit about what that entails.
Well, I am one of the 2 Transcultural Health Managers here for the coastal region.
There's only 2?
There's only 2 of us for the coastal region.
Oh.
So our Greater Charlotte and Winston-Salem markets has had this role for a couple of years now.
Okay.
And with the integration of Novant coming for the coastal region, they wanted to make sure that we had this role that was ready.
Yeah.
And as a Transcultural Health Manager, we work for the Office of Health Equity.
Okay.
Okay.
That makes sense.
So working for the Office of Health Equity, we like to look at things through our Real Gaps lens or our Health Equity lens. And we discover that there are gaps and disparities among communities and different cultures. So the Transcultural Health Manager is looking at the different types of cultures within our communities that we have and how can we get them the remarkable care? Where can we get them equitable health care?
Yeah, you say this is new for the region. So how do you start this program? Where does this all, how do you focus on that? Where does that?
When this was proposed and it was started here in our coastal region, we knew you had to get out there. You had to make the relationships.
Yeah.
You had to talk to folks who were interested. And with all the institutes that Novant Health has, there was always someone there. And we come to find out that most of our dyad leaders that we had or the institutes were already looking at health equity issues. They just didn't know what the word was or how can we do this. So we were able to go in there, make the relationships with them, look at what they had, not reinvent the wheel, and progress it, make it better than what they already had.
Well, I know a little bit about Novant Health's goals around mammography.
Yes.
And so how did that help here locally? What did we learn from that?
What we learned was looking with our health equity lens, we could notice that our patients from our Asian communities were not getting their mammograms. They were not, they were not receiving information. And we were wanting to know why. You know, that's the thing about the Office of Health Equity. That's one of our big questions is why. And so looking through our Real Gaps lens, trying to figure out what was happening, we realized that there was a cultural component. And looking at that cultural component, the Office of Health Equity and the Institute partners were able to develop best practices that gave the patient the time to disrobe in an area that was more secluded or limited the time for exposure to the provider while the mammogram was being completed.
Yeah.
And with this initiative that was started, we have seen a drastic increase and rise in our Asian communities that are getting their mammograms.
Really?
They're our highest communities right now that are receiving the mammograms versus any other population or community we have.
Really?
Yes, ma'am.
That's amazing.
It is.
So you started this process of collecting data from different areas on different cultures,
Yes.
so that you can come up with these best practices?
That is correct. What we do is the Office of Health Equity and the team, we look at strategies and we start looking at, like I said earlier, the whys. And looking at a real gaps lens, we're looking at race, ethnicity, language, gender, age, our payer sources, and
I never
things
thought about
from sexual orientation and gender identity.
Yeah.
And once you start utilizing that data, the data tells the story.
Yeah.
It'll tell you if it's headed in the right direction or have we hit a bump in the road. And if we hit a bump in the road, you take a step back and you say, hey, what have we missed? And that's the piece for health equity.
Well, I know there's, we talk about health disparities a lot. And when we have these disparities, does it increase the risk or the complications or even maybe death because we have such disparities in the country?
Absolutely. Right now, the United States is facing one of our biggest crises that we have, Black maternal crisis.
Really?
We are looking at a 58-year high that a study has been completed that the African American and Black moms and babies are 3 to 4 times more likely to die before, during, or after child labor.
Wow.
Yes, ma'am. And with that, we looked at it and said, hey, what's going on? So we're looking at social determinants of health.
Right.
And some of the social determinants of health that we're looking at are good, nutritious foods. Are they able to get to their doctor's appointments?
Yeah.
Do they have the access to make the appointments? Also, discrimination and racism based upon bias.
Wow. So what are we doing to address all of these issues with this?
One of the most, I would say, one of the positive initiatives that we have done in February of 2021, our community engagement team started and piloted a program. This program was placing doulas and community health educators together to go out and be part of this birthing experience.
Oh.
Okay, and so are you familiar what a doula is?
I was going to say, for our viewers, maybe we need to talk about
Absolutely.
what a doula is.
So a doula is someone who is trained to actually be part of the birthing process from beginning, during, and after. And with our community health educators, they're able to get together and say, okay, we're looking at pregnancy issues, pregnancy problems. How can we help guide our mothers along? And with this initiative, it was a 2-year federally granted funding that they were following 30 mothers within the New Hanover, Columbus, and our Pender counties.
Okay.
For 2 years, they followed them. With the utilization of the doulas and the community educators, we didn't lose any of our moms. We didn't lose any of our babies.
Wow.
That's the best part about that was the positive end to this. Now we're able to say, hey, this is something. Are we still working on it? Absolutely. We're still on a 58-year high of it. But now we can extend this out through our Novant fingerprint and get folks taken care of that are needing our help.
So that is a really great story. I cannot believe how much progress we've made, and you didn't lose any women or any babies in a endangered group, so to speak. So I know that you've been a nurse for a long time, and I'm wondering how helpful is that nursing background in this cultural program that you're, this transcultural manager role that you're in? How does that nursing degree or that nursing experience, I would say, how does that help you?
All of our transcultural health managers for the Office of Health Equity have a clinical background.
Really? Okay.
With this clinical background, we're able to go in, we can look at physician or provider notes, we can look at nurses' notes, we can look at the processes and say, you know, maybe we're missing one key part. And that's where we get with our our best practices. It's almost like when you were younger in school, the scientific method.
Yes.
You always start with a hypothesis.
Yes.
I feel personally myself within the Office of Health Equity as a transcultural manager, I kind of look at that, I look at my hypothesis, and I want to ask 5 questions.
Okay.
Who, what, where, why, and how. And from there, you can start to see the gaps. You can start looking at the disparities. And once you see the world through a health equity lens or through a real gaps lens, your vision changes. And then you start to realize that the patient is a patient, and we treat them as a whole patient and not just a diagnosis.
Yeah. You're amazing to talk to. Where do you get your passion? You've always, as long as I've known you, you are a very passionate person.
I come from a family of, I made it.
Yeah.
I can say that. I made it. And
That's awesome.
a lot of my family's like, you've always made it. And that was, you never look at the underdog. You never look down on the underdog. You always want to know why. So.
Well, Joe, thank you so much for being here today. It's been wonderful chatting with you, but I have so many more questions. I hope you'll come back because this is a relatively new role, and I want to see where we're going.
Absolutely.
How, where we've come from and how far along we are. So you'll come back?
I absolutely will,
Great.
and I would love to share more information.
Great. Well, you've been a great guest. Thank you so
for
much.
having me.
Our last guest today is Dr. Robert Colucci, who's with Novant Health Psychiatric Medicine located in Charlotte. Welcome to the show today.
Thank you.
So happy to have you here. I know we met a long time ago when you first interviewed, so it's been quite a while.
Yes, it has. Settling in, but thank you.
Thank you. We're really happy that you're here. So let's introduce you to our viewers. Tell us where you moved from and where you did your residency, things like that.
Okay, I moved down here the end of February, coming from Long Island, that's in New York, beautiful place. And I came down here for, I would say, a better quality of life during my...
I think you'll find that here.
I've noticed that.
Yeah, it's a great place to live.
It really is. Everyone has been very warm, welcoming.
Yeah.
My background has always been in psychiatry, community medicine, trained at New York College of Osteopathic Medicine. After that, I did my residency at, then it was Hillside Hospital. And then from there, I did my child fellowship at Schneider's Children's Hospital. And then went right out into the world of community medicine, did some inpatient work, substance abuse work. But community medicine, community psychiatry is really where my heart is, and that's what drew me here, is their program.
Yeah, that'll be great for this area. I'm really excited that you're here. What brought you to Brunswick County? Just the position, or were you familiar with us before?
No, not really. Familiar with the Carolinas,
Yeah.
but I interviewed all over the place, up and down the East Coast, New Hampshire, Delaware, Florida, Carolinas.
Wow.
Making a big move after being born and raised in New York, I wanted to make sure the place I picked really met my needs.
Yeah.
And the position really, which did attract me here, the new mental health clinic they have in Charlotte.
So let's focus on the practice. What does a typical patient journey look like in your office? What happens on their first visit?
Okay, usually they referred from the community, primary care physicians primarily, or through Novant system, through the primary care system there. And when they come in, it's, again, because of the community where we're in, and sadly mental health is so underserved.
Right.
They'll come in with a variety of problems, most people depression, anxiety, sometimes with mood disorders, a lot of post-traumatic stress disorder. And then they come into the office and I'll sit down with them and really introduce myself, give them a little bit of background about me, being new to the community, and then hearing their story and what their needs are.
So is the visit like an hour, or is it longer for a first-time patient?
First time
New
visit,
patient?
yes.
Quite-
Usually first time visit is a good hour long. It's flexible, obviously. If
Right.
we're in the middle of something, I'm not just going to say, sorry, our time's up.
Right.
So it's about an hour long, and then depending on where we go from there, follow-up visits are 30 minutes. And again, depending on the person
Yeah.
and their needs, it could be, in 2 weeks or a month. Usually in the beginning, it's every month.
Do you think that during the pandemic that brought mental health issues to the surface a little more? Do you think that folks suffered more in silence during the pandemic?
That's a difficult question in the sense that
Well, then forget I answered.
in the reality that mental health, in my mind, doing this for 20 some odd years,
Right.
has kind of always been in the shadows. It really has been. And people have a very difficult time, discussing that with and it's usually a primary care physician that will meet them. They'll come in with maybe some medical complaints or concerns.
Right.
And then things will unveil. But yes, I think COVID absolutely set mental health probably further backwards in the sense that
Oh, that's too bad.
a lot of anxiety and other traumas came out, and no place to go for treatment.
Right.
Difficult.
It is
Yes, it
difficult.
really did.
Yeah, it is difficult. I know, I guess medication is one treatment option that patients can choose. Is that pretty typical?
You're right. Usually when they come to me as a psychiatrist as opposed to a
Like a
social worker
yeah.
or a mental health counselor, the goal is, as a referral coming in from primary care, is they're at that point where they've tried everything else.
I see.
And they're looking for medication. And even with that said, I explain to every patient that medication is helpful and it could be helpful, but it's not the answer. You really got to advocate for yourself.
And do you always hit is the medication that you give the first time, is that typical that you stay on that, or do you have to play with the medications?
Again, sadly, unlike other areas of medicine, there is no one test to say this will work for you.
Right.
Not a blood test or anything. They have come up with genetic testing, which is kind of bringing us closer to kind of fine-tuning what medication, but usually you kind of know from your experience, their symptoms, what medication will work best, hopefully. But unfortunately, I do explain that too also up front, is that maybe the first medication won't help. Be patient.
Yeah.
You may have to try one or two other medications.
What happens with a patient who is in crises? And end up in the emergency department or something like that, then would they be referred to you?
So for us as an outpatient center, right, if it's an emergency, then yes, either, again, I'm getting familiar with the area,
Right.
There'd be like a mobile crisis would come in, or they hopefully maybe a family member would bring them to the emergency room, and then from there they would then, depending on the situation, hopefully not need to be admitted, but if they need to, they need to for their own safety, but then could be referred back to us or another facility in the community.
This is such great information, and it's really a new topic for us. So I would love to have you come back, because there are just so many more questions about mental health in general, especially in this area. Will you come back?
Oh, 100%.
Great.
Absolutely. Thank you.
Do you need a referral to see you? I forgot to ask that.
Yes, everybody would have to be referred
Right.
to the program, 100%. So either from the primary care center that they're going to, or through Novant directly.
Okay, good information. Thank you so much again for being here. It's my pleasure having you.
Always, thank you.
Thank you for tuning in to HealthWatch. I hope this information was beneficial for you or your family. To find a doctor or to learn more about services provided by Novant Health, please visit our website at novanthealth.org. So be sure to join us next time right here on HealthWatch.